The forced expiration technique is a specialized breathing technique used primarily in respiratory care to help individuals clear mucus from their airways. It is often recommended for patients with chronic respiratory conditions such as COPD, bronchiectasis, or cystic fibrosis, where the buildup of secretions can worsen the disease state and lead to infections like pneumonia. This video covers the medical definition and provides a brief overview of this topic. So if you're ready, let's get into it. Forced expiration technique is categorized as an active cycle of breathing technique, and it aims to manipulate airflow within the lungs to mobilize secretions, making it easier to expel them. Unlike more passive forms of clearing the airway like simple coughing, this technique requires specific steps and a somewhat more complex procedure for maximum effectiveness. These steps often involve a cycle that includes a period of normal breathing, a series of deeper breaths, and then a controlled forced expiratory effort that moves the mucus up the airways to be expelled through coughing. Respiratory therapists are typically involved in the initial instructioning process on how to perform this technique effectively. The efficacy of the forced expiration technique is backed by scientific research, which shows that it can be more effective than regular coughing alone in removing secretions, reducing symptoms, and improving overall lung function. It also has the advantage of being less taxing on the respiratory muscles compared to other techniques like Huff coughing. This makes it a particularly useful tool for those with weakened respiratory muscles or for whom sustained coughing is uncomfortable or ineffective. Forced expiration technique has a number of advantages, such as the fact that it can be performed without specialized equipment, making it accessible for people to use in their home setting. It also places fewer demands on the cardiovascular system compared to more aggressive methods of airway clearance, making it suitable for a broader range of patients, including those who may be frail or elderly. However, it's crucial that the technique be taught properly to ensure that it is both effective and safe. Improper use can potentially lead to airway constriction or even collapse in extreme cases. Furthermore, this technique should ideally be a part of a comprehensive respiratory care plan tailored to the individual patient's needs. It may be combined with other techniques like postural drainage or even pharmacological interventions like bronchodilators or mucolytics to maximize its effectiveness. Regular monitoring and consultation with healthcare providers are recommended to adjust the technique and approach as the patient's condition changes. So as you can see, the forced expiration technique is a scientifically backed, effective method for airway clearance primarily aimed at patients with chronic respiratory conditions. It offers a blend of efficacy, safety, and ease of use, but proper training and regular medical supervision are crucial for maximizing its benefits. If you want to support the channel, please like and subscribe. I would greatly appreciate it. And there should be some other helpful videos popping up on your screen right about now that I think you will enjoy. And just a quick reminder, we are not doctors. This video is for informational purposes only. Thank you so much for watching. Have a blessed day. And as always, breathe easy, my friend.